My first step was humanitarian medicine. Before I entered the world of Western medicine, I was working for Doctors Without Borders for 7 years. So I finished medical school in 2011, and after that I studied tropical medicine in Belgium. And then I ended up working in Africa and Europe here and there. I chose my specialty when I was in residency. I was working in both a clinic as well as in the hospital. I was able to find this position where some call it a dualist, some call it a traditionalist, where a primary care doctor who works in the outpatient setting follows their own patients in the hospital. When I see the patient who I know from the office, it's a fundamentally different relationship where we're really able to have that more in-depth discussion. I'm able to ask them those nuanced questions about what is going on, what happened over the last few days, because I know what happened a few weeks ago or a few months ago. That first visit, we call that the establishing care visit. That's essentially me learning everything I can about them. What is the physical environment that you live in? Where do you live? How do you go about your day? What diseases have you been diagnosed with so far? What medications do you take? What do you know about your diseases? What types of educational tools have you gotten so far? And from there, if there's any type of a gap to fill, I'd try to do that. One of the biggest things that I learned about the importance of communication, identifying where patients are at, that's always stuck with me. Always trying to identify the best way to communicate with people that you're working with so that you'll be able to ultimately help them in whatever situation they're in. Being able to let somebody live the way that they want to live is the best part of the job.